The first I'd like to talk about is the onset of regular contractions. These, what we're looking for is a regular rhythmic pace. Once they establish, you will receive contractions every 2 to 3 minutes. If at any stage you are unsure of how your contraction pattern is going, you can pick up the phone, call the unit, and one of the staff on the end of the phone will be able to advise you on the next course of action. Another symptom of labour can be back pain. It can be quite uncomfortable and takes some getting used to when it first starts. These can couple with contractions and you can feel quite uncomfortable. What we would recommend in this situation is use of water, so have a bath, a shower, whichever is comfortable for you, and if it's appropriate to maybe take a paracetamol just to ease the back pain. Another sign that your labour may be coming is the loss of your mucus plug, commonly known as a show. This represents itself as a mucousy loss. Could be different in colour, anything from clear to slightly tinged with maybe a green colour. What you don't want to see is any fresh red bleeding. If you are unsure at any time of what actually is on your tissue, you can pick up the phone, call the unit, speak to one of the staff here, and they will be able to advise you appropriately over the phone. The one thing to remember is not to panic. Spontaneous rupture of membranes or your waters breaking is another sign that your labour may be approaching. The first thing to say is don't worry. This does happen to some ladies, not all. The important things to remember are to note the time of your waters breaking, the colour of your waters, maybe if needs be, pop a pad into your underwear and phone the unit. Speak to one of the staff, give them all the information, and they will invite you into the unit to just assess whether your waters definitely have broken or not. If your waters have broken, we will assess the colour and the amount of water that's coming away. In the absence of contractions, we will send you home to await events, with a booked appointment for 24 hours later to return to the unit if your labour hasn't started on its own. If you attend the unit, your waters have broken and you are spontaneously contracting, you will be invited to stay in the unit to progress your labour here. Finally, another symptom of labour is the onset of loose bowel movements. This is rare, but some women do experience it. To summarise, the symptoms of labour listed today: the onset of regular contractions, back pain, a show or the loss of your mucus plug, spontaneous rupture of membranes or your waters breaking, and loose bowel movements. If at any stage you are unsure, worried or concerned, pick up the phone, call the unit and speak to a member of staff here. Above all else, try not to worry.